Hi, I'm Olivia Hind. I'm Head of Partnerships at Oviva. We are a digital health company focused on supporting people with poor health related to diet and nutrition, improve their outcomes and improve access to specialist dietetic care. And in the UK, we're really focusing on type 2 diabetes. There are 3.4 million people with diabetes in the UK, and the vast majority of those people have type 2. In Yorkshire and Humber, the prevalence rate is kind of about the average, but it is really variable across the patch. So in Bradford, prevalence is about 10%, which is much higher than we would see across England. And the cost of diabetes to the NHS is about 10% of the NHS budget, which is £8.8 billion a year. The real problem with that is that a huge proportion, around 80% of that spend, is on treating complications that we know could be either prevented or reduced through good diabetes control and good diabetes care. And these are devastating complications as well as being costly. So diabetes is the leading cause of non-traumatic limb amputation, the leading cause of blindness and renal failure in working age people. And we know that people are not meeting the treatment targets that NICE says are necessary for good diabetes control. So that's things around blood glucose, blood pressure, and cholesterol. And often that's because most of diabetes care is self-care. It's what people do all day, every day in their own home. And so NHS England and NICE recommend that everybody with diabetes should be receiving some form of structured education at the point of their diagnosis. And the theory behind this is that structured education can help people understand more about type 2 diabetes and how they can change their lifestyle to reduce their risk of complications in the future. But the challenge with many of the existing programs out there today is that they're group-based, face-to-face education programs that have really quite poor uptake. So it's estimated at anything between 2% and 30%. And even for people that do make it along and are able to take the time off work or arrange travel or childcare to get there, it's really difficult then to track the impact that those courses have on clinical outcomes and the risk of complications in the future. So at Oviva, we worked with clinicians, academics, technology experts and patients to try and think of an alternative approach that would meet the needs of people that couldn't make it along to group-based face-to-face programs or where that wasn't appropriate. And so Oviva Diabetes Support is a completely remote service that's delivered one-to-one by a diabetes specialist dietitian. It's delivered as a course of 8 weekly coaching sessions plus some time at the beginning to understand the person's condition and some time at the end to agree long-term goals. And those coaching calls are delivered over the phone or using the Oviva app. And then alongside that, we have a range of evidence-based structured education materials that people can access online, or we can send them through the post. People can follow those at their own pace, and then they use their coaching sessions to use the stuff that they've learned, talk it through there with their dietitian, and think of ways that they can implement and really change behaviour to put that into practice. And then we use the Oviva app to help people monitor their food intake and discuss that with their dietitian, and to track their progress as they go through the programme. We found that it's really helped us move away from just information giving and giving people advice to being able to put that into practice and see a change in behaviour. These are just some kind of snapshots of what the learning portal looks like, so people can access this at home, or we can send them a DVD, and we can send them a guidebook depending on their individual needs. And obviously you can go back over and over and over this again, and patients retain access to it for life. So once we've discharged them, if there's anything that they need to go back and check, they've got it there forever. And this is what the app looks like in terms of how people communicate. And people can speak to their dietitian securely through the app, or they can use the phone, and we also set up all of their goals there so that they can keep tracking once they've been discharged. We've now used this technology to build our diabetes prevention programme as well, which is for people that are diagnosed at risk of type 2 diabetes, and we're rolling both of them out across England. We're in 18 CCGs as of this week, and we're really proud of the outcomes that we've managed to collect so far. So our uptake rate is about 75%, which is in comparison to that 2 to 30% rate. But more importantly, we've seen a real impact on clinical outcomes. So the average reduction in blood glucose levels is about 11 millimoles per mole. So for non-diabetes specialists in the audience, that's a significant impact in terms of the 6-month post-discharge outcome, which we can look at to see the forecasting and reducing the risk of complications. Our patients are also really happy with the programme. In the friends and family test, we have a score of 99.6%. And in terms of cost savings for the NHS, our frontier economics analysis shows that for each participant that completes the programme, it's roughly about over £1,000 in savings in terms of reduced medication and reduced service utilisation in the future. And that could be really significant if we scaled this across the whole of England so that people are offered an alternative to face-to-face group-based structured education. We're not delivering our diabetes support programme in Yorkshire at the moment, so if anybody would be interested in speaking to us about how we might be able to help either with your patients that are at risk of type 2 or that are diagnosed with type 2, I'll be in the hall area for the rest of the afternoon. Thank you.